The skill we're going to perform is seizure precautions. First things you need to do is perform hand hygiene. And this is done by washing your hand and by the use of alcohol. Once you've done hand hygiene, next step is you need to enter to the patient's room and introduce yourself and identify the patient using at least 2 identifiers. Hi ma'am, I'm Harley Gamma Jr. I'm your nurse today. So before we proceed, may I ask your name and date of your birth? So after verify the patient's name and introduce yourself, next is you need to begin the initial procedure. So there are 4 things that we want to take when doing seizure precautions. So first of all, we want to make that there is a pillow beneath the patient's head. So a pillow is very important because it elevates the head of the patient, and this elevation prevents the pooling of secretions in the mouth, which could zip into the airway. So if the patient's head were to be flat, so the secretions might end up going to the airway, and this could cause airway obstruction. Then second things we want to note is that the side rails and pad. So in our case, we don't have side rails or pad. So what we're going to use is our pillow. So side rails or pillow are so very important. So because they prevent the patients from falling down. And the third things you want to take note is that the bed height as low as possible. So because we want to keep the bed height for 2 reasons. So first is to minimize the injury of the patients. So if ever the patients were to fall during the seizure. So because the closer the bed to the lesser the chance of the patients sustaining very serious injury. Then last is keep unnecessary equipment. So of the patient's room, like sharp objects, because that is risk for the patients. That is risk to the patients. Then next is, so once you assess these 4 things, the pillow beneath the head of the patients, the side rails with pad or pillow, the height of the bed of the patient, and also the unnecessary equipment. So you also want to prepare the sanctioning equipment. So sanctioning equipment. Then this is one. So and your oxygen. So after that, you also want to prepare the suctioning equipment. So next is you need also to in our situation we have also this oxygen tank. However, this is not the only things you can use. In fact, you do not have an oxygen. You can also decentralized oxygen or simply an oxygen bag. And also this is so very important to keep these 2 ready by the patient's bedside, because so in the event that sometimes something that happen, interventions can be immediately to help the patient. And also assign the patients to the room in close approximately to the nurse station, so to maintain continuous observation. So you need also to instruct patients to do not get out without assistance. So assure that the call bell is reached by the patient. So make sure that the family knows where it is and how to use it. And also you need to advise the patient to avoid use of restraints, because restraints can cause injury to the patients. And obtain a one-to-one care provider. So if patients is unable to follow instructions to maintain safety, and also you need to check the patient's vital signs every 15 minutes. So and maintain airway patency, and also maintain patency during the post-ictal phases. And finally, it is impressive that the nurses focus on observation and response. Being at risk of having a grand mal seizure while unattended is extremely dangerous. So because of the potential of catastrophic injury and or choking. So when this risk is identified or should be identified, so the nurse owe a duty to know whenever there is an onset of a seizure and be in attendance during the clonic and the post-ictal phase. So that's all for seizure precautions, and thank you.